Okay, so next we're going to do active range of motion test, or a whole shoulder assessment, and we'll start with active range of motion testing. So Flo's going to demonstrate what to do. So you as the examiner could stand in front of your patient or your athlete and do the whole thing with them rather than just explaining to them what to do. So we're going to start with shoulder flexion. So you're going to ask them to bring their arms all the way forward as high as they can. When you get to the top, you can go look at the side for a sagittal view and see if they get to the same point, okay, which he does have. Okay, and then you're going to ask them to come all the way back down and go into extension or hyperextension. Okay, so again, we can compare, make sure we have the same degree of extension. Good. Then we can go into abduction. So our first abduction, we're going to touch the backs of the hands together overhead. Okay, so most people should be able to touch the backs of their hands together. However, if there's an injury, you may ask them to come back down and then touch their palms together. So we're essentially going to externally rotate at the shoulder, touch at the top, and that can be a lot more comfortable for some people. Then we're going to get into internal and external rotation. We don't have to do a separate adduction movement because when they come back down from abduction, that's doing the movement there. So for internal and external rotation, you want to look at their back, and we do what's called Apley's scratch test. So we ask them to bring one hand behind the small of their back. Oops, can't kick that. What you can do is come right back here. So this is internal rotation, what he's doing now. And then the other side, he can get up a little bit higher, so then we can compare where the two hands were. Then for external rotation, he's going to come over the top, and again we can mark on his back where he gets to, and then with the other side. Okay, so these ones are pretty much equal. Then for the shoulder, we also have to do cross flexion. So the patient or the athlete is going to reach across their body, okay, and then they can even reach to the back, and then you can compare if they turn around. So right here, and then the other arm, okay, right here. So pretty much equal. So once those are done, you can get your patient to have a seat, or they can stand. It's really up to you. And we can do passive testing. So we're going to look at the same ranges of motion. So just like all the other ones, hand on the joint. Okay, arm needs to be really loose. Okay, you're going to come up into full flexion. Okay, when you get to the top, some overpressure, really stress that joint. We're feeling for any clicks in the shoulder, grinding, popping, anything producing pain. We want to make sure they can get full range. Then if we want to do extension, we just switch the hands and come backwards. Okay, so 3 to 5 times. Then abduction, so coming up this way in the frontal plane. Okay, so that's good. For adduction, again, we're coming back down, so we don't need to do it separately. Then for external and internal rotation, we need to keep one hand on the joint. So what we can do is use our hip to block the elbow. We want the elbow to stay close to the body. Okay, so we're going to come out as far as we can. And then for internal rotation, just turn a little bit. We're going to bring the arm behind the back and pull the hand away from the back. So that's internal rotation. Okay. Cross flexion and cross extension, you're just going to come all the way across and then all the way back. Making sure that you're just moving at the shoulder joint and you're not turning the whole body at the trunk with this one. Okay. Then we can move on to isometric resisted testing, so testing the muscles around the shoulder. So for flexion, we're going to get them to hold this position here, so a flexed elbow. Hand here just to stabilize, the other hand goes around the bicep, and ask them to either push forward or say, don't let me move your arm back. We're going to do it for 3 to 5 seconds. Okay, really challenge their strength. Switch hands and push back. and relax. Okay, so that's flexion extension. For abduction, we need to do it two ways. So our first is going to be right with the elbow right against the body. So push out into my hand. Okay, so we're between 0 to 15 degrees of abduction. Relax. So this is testing mainly supraspinatus because that's the muscle that works in that small range of motion. Then we're going to bring them up to about 90 and say, don't let me push your arm down. This one's testing more deltoid. Relax. Then for adduction, we do have to do this one. So we get them to hold their arm here and say, don't let me pull your arm away. Okay, relax. Then internal and external rotation. You're going to ask them to, for external rotation, push out. Sometimes it can help to if you show them the movement. And again, we want their elbow to stay close to their body. So with your other hand, you can pin it there. So push out against my hand. Okay, relax. And then you can hook your arm around for internal and pull in. And relax. Good. Then for cross flexion, you can do it this way or this way. It doesn't really matter. Hold your arm right here and pull in. Good. And then switch your hands and push out. And relax. Then for our special tests, we had 3 of them for this class. So first one is empty can. So you're going to ask your athlete to hold 2 cans in front of them, empty them. Okay, we're going to bring their hands out, not to the horizontal, but to about 30 degrees from there. We're going to push down at the elbows. Okay, don't let me push you down. And relax. Okay, so this one is testing for supraspinatus tendinitis. If they have pain or weakness, that can be indicative of that condition. Then we have Speed's test. So they're going to put their palms face up. So we have a supinated position. Don't let me push your arms down. And relax. So this one is testing for long head of biceps tendinitis. So again, if they have pain or weakness, they may have that condition. And then our third one is a little bit different. This is called the apprehension test. So on this shoulder, flow is going to be negative for the apprehension test. So passively, we're going to bring the shoulder up into 90 degrees of abduction, 90 degrees of shoulder, of elbow flexion. We're going to passively externally rotate, and he's letting me do that. So this is negative on this side. If this was the involved side, okay, we would try and bring him up. And as soon as I try and externally rotate, he kind of pulls away. He doesn't want me to do that. He's apprehensive. And this is indicative of a previous shoulder dislocation or shoulder laxity. So we're not looking for pain here. We're looking for that apprehension and him pulling away from being in that externally rotated position. So after we've done our testing and then our special tests, there are more of them as well. Just not for this class, then we would do some palpation and have a better idea of what might be going on at the shoulder.